Okay, I think most people who are going to be here are on, so I'll get started. I want to welcome everyone. I'm speaking to you at what I know is an increasingly challenging time, a time of disruption in the life of our country, a disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all. Those are actually the words of Queen Elizabeth. And if you didn't have a chance to see her speak earlier this week, it's a demonstration of leadership. And it got me thinking. The first time she addressed her country was 1940, just before World War II. And here it is bookend in her career as Queen, dealing with the coronavirus and COVID-19. It helps me at least put this problem in the perspective of history. I want to send my regards to all of you and your families. Everyone feels uncertainty right now, even fear for our own health, fear for the health of our loved ones, concern for those less fortunate here, throughout the country, and throughout the world. We've seen unimaginable situations just in the last couple months. The physical exhaustion by healthcare workers spread too thin. ICUs, especially in Italy, where they had to make life and death situations when they had too few ventilators. Issues of personal protection equipment, or PPE, that we never thought would be in such short supply. Even freezer trucks for the dead outside of hospitals. With every statistical mortality is a life lost and a mourning family. I don't know how many of you are touched directly. We can't help but be touched emotionally by what's going on. Running in parallel with the healthcare crisis is an economic crisis. So much is unknown. We just heard that our university budget is budgeted out 3 months, but I am concerned about the university finances as well as the finances of our college. We just had the largest bill ever at $2.2 trillion, the Family's First Coronavirus Response Act passed, which gives some glimmer of hope in terms of employee paid leave, unemployment coverage, and support for small businesses. As we watch the news and look at the data, we hope that we're helping to flatten the curve. We still have so much to do, and all of us play our part. Now, physical distancing is hard. We used to call it social distancing, but actually we need each other now more than ever, and thus this opportunity to at least digitally get us all together. We don't know when things will be back to what is the new normal and how long this recession will last. But I can tell you one thing, and you may have seen me write it in the various statements I've sent out to our community over the last few weeks. Things will not always be this way. Thanks to what you are doing right now, being in your own home, visiting with people at best digitally, we're doing our part. But I must mention the difficulties for those who are on the front line. Many of our friends, colleagues, our clinical faculty, doctors, nurses, APPs, other clinical staff, support staff, housekeeping, they're all doing their part. And what is also unimaginable is in the ICU with patients who are critically ill, doctors and nurses are acting as family. The loved ones that maybe can make connection to families of patients who can't even come in to be with family that is very ill or could even be dying. The people on the front lines inspire us and give us hope for the future. I want to share with you other inspiring stories from our College of Medicine. Our research labs and those of other research labs at UVM have been donating masks and other PPE, thanks to efforts from Beth Kirkpatrick and Gordon Jensen. Under the leadership of Dr. Deborah Leonard, our college has partnered with the state and UVM Medical Center to provide expertise, materials, and effort to assist in coronavirus testing. Our clinical chairs, the medical group, medical center, and health network have partnered with our faculty to prepare for a surge, even with redeployment of duties. Dr. Deschamps will talk more about this, but just imagine someone who's been in practice in something having nothing to do with infectious disease, retooling to be able to help out in case of a surge. Now, faculty, staff, and students have gotten together to develop the LCOM Cares Service Corps, and a task force that includes students, staff, faculty, both graduate and medical student representation, is getting together to participate and help out where they can. And let me share some examples there. We sent out a survey to our medical students asking who would be interested and able to participate either clinically or not clinically. And we had an amazing response rate of 342 students, and 94% of them said, yes, count me in. We're also planning to send a similar survey to our graduate students who have reached out looking for ways they can help. One of our medical students has developed a program that now includes 45 schools in 26 states, collaborating medical students from different medical schools. If you think of it, we have medical students in other cities, connecting medical students from our College of Medicine with the local academic medical center to see where they can help. We also have a task force working with our Western Connecticut branch campus colleagues as well. Here at the medical center, we've got 10 students working to train people in donning and doffing PPE. We've got 23 students working to set up and support the field hospital that's being created. We have 12 students working in a donation center and 15 students working on the COVID-19 community hotline. In our community, we have medical students helping to provide food for the families of frontline clinical workers. And we've got 40 students signed up to help out in terms of providing even childcare and pet care services for healthcare workers. We've got students providing phone buddies to the elderly who can't be visited by their family anymore, and even virtual nursing home visits, including poetry, short story reading, music, and yoga for those who are shut in away from their families. We've got outreach to help those who have housing vulnerability. In the general community, we have a dozen students helping out in such things as Meals on Wheels, grocery shopping for the elderly, building boxes for the Chittenden food shelf, and helping out in the Red Cross. And finally, our students aren't all here, and we have students in other communities helping out as well. For example, one student in Oklahoma who's organized a group making masks to protect people now that we have universal masking. These are just a few of the stories out there of members of our community who frankly inspire me, and I hope inspire you in terms of reaching out, volunteering, and making a difference. So tonight we want to provide for you an update in various domains in the College of Medicine, and that's why I'm pleased to be accompanied by, on a virtual panel, Drs. Carney, Dr. Claude Deschamps, Dr. Gordon Jensen, and Dr. Christa Zehle. We're going to have 4 presentations, and then we'll take questions. We've received a number of questions already, and the line is still open in terms of that email if you want to submit questions. I will confess we have a lot of questions already. We'll get to all that we can this evening. So with that, I'd like to turn things over to Dr. Jan Carney. She's Associate Dean for Public Health and Health Policy. Dr. Carney.
Thank you, Dr. Page. And I'm so glad that we're doing this tonight, where we know we're in the middle of the COVID-19 pandemic. And I think that from my perspective, no state could do it better. We're all working together. People are pitching in. We're trying to help each other. We're all in it together. And I think that's the most important place we could be right now. I want to reinforce the messaging about social distancing that we're now describing more accurately as physical distancing, keeping people apart from each other, but staying socially connected, because it is really hard. I want to emphasize how well it works. And we know this from the 1918 pandemic, influenza pandemic, and different cities that did this better. They physically separated people with closed schools and limited people in public settings. Their mortality rates were much better, and they fared better overall. So we know this is effective. The current data also supports this from what we've seen already in other countries. We know it's especially hard for people with limited income, who may be working minimum wage jobs, and it's been very, very challenging for many people in our community. But we have to keep at it and bear with it for a while longer, so we're absolutely sure that it's safe to go back to more of our usual activities. Another area I want to mention is the new recommendation from both the CDC and our own health department about cloth face coverings. I'm not talking about medical masks. I'm talking about cloth coverings that people wear on their face and the rationale behind that and why that could also help us. The reason is that we know that there are some asymptomatic and pre-symptomatic people who may be spreading the infection before they have any symptoms. And what those masks do, in combination with hand washing, social distancing, and isolating sick people, it can protect others. So if you think about the locations for that, it might be if you're out in a public setting where it's really hard to be distant from people at all times, like a grocery store or pharmacy. If you're wearing a cloth mask, then you will be protecting others from you. And likewise, if everyone is wearing that, we add another level of community protection. And that's the rationale for that. Again, they're not a substitute for social distancing, hand washing, not touching your face, cleaning our phones and other environment surfaces. They're in addition to, and that's the rationale from that. I would also like to mention another question that commonly comes up is how long does COVID-19 live on environmental surfaces? And the information from the National Institutes of Health says that it can be in aerosols for up to 3 hours, another part of the recommendation for the cloth face coverings, up to 24 hours on cardboard, and up to 3 days on plastic and stainless steel. Now, we don't want people to get even more nervous about this, but just remember again, to wash your hands on a regular basis and clean those surfaces, whether it's in your home or your cell phone, on a regular basis. And again, I guess from my perspective, I would limit your servings of television watching and news watching to a couple times per day, because I think that we can be absolutely bombarded by up-to-the-minute updates. And remember those evidence-based resources from the CDC, our health department, the UVM Medical Center and Health Network, our World Health Organization, and there's a wonderful series that's updated regularly from the New England Journal of Medicine. And that's the end of my message. And I want everyone to know that I'm here right with you and will do everything I can to be a resource and help in any way that I possibly can. And thank you, Dean Page.
Thank you very much, Dr. Carney. Our next speaker is Claude Deschamps. Dr. Deschamps is Senior Associate Dean for Clinical Affairs and President of UVM Health Network's Medical Group. Thank you for joining us tonight, Claude.
Dean Page, good evening, everyone. I wish to add my own words of welcome to those of Dean Page and Dean Carney and express gratitude for the work by all our providers, faculty, learners, especially those on the front lines. I'd like to add a few words about the virus and the disease it is causing. It is a highly contagious disease and may cause significant damages. The best literature changes rapidly and frequently. Here's what we know. There are 5 days of incubation period, 8 days of infectious state, and 1 week between infections and hospitalizations. Symptoms include fever, headache, dry cough, muscle pain, GI symptoms like nausea or diarrhea, loss of smell, and fatigue. And sometimes some of those symptoms are in isolation. 80% have mild or even no symptoms. 20% of patients require hospitalization. While most people recover, older people and patients with comorbidities are at higher risk of complications, including death, unfortunately. Our network has 6 hospitals across 2 states, a medical group of over 900 physicians, including over 700 faculty members, mostly in Burlington, a home health and hospice agency, and several nursing homes. Our preparation and response so far has been proactive, coordinated, and of the situation. We have stopped performing elective surgical and diagnostic procedures. We have postponed all non-essential in-person clinic visits. We have ramped up our telemedicine capacity across our entire network. We have expanded our acute primary care access capacity. And we have set up field hospital in the Patrick Gym and near the emergency room of our academic medical center. Every department of the College of Medicine, led by their respective clinical chair, has a plan to face the surge. That includes a people deployment process across 9 high-risk service areas and involve faculty, residents, fellow, and advanced providers. Let me add a few words about testing. Under Dr. Deborah Leonard's leadership, all diagnostic tests focused on detection of the virus genetic material, RNA, using a number of testing protocols. UVMMC is currently only sending testing to reference laboratories like Mayo Clinic and the Vermont Department of Health Laboratory, which all tend to have progressively longer turnaround time for results as volumes of testing increase. The newer option we are setting up now is through the Broad Institute in Boston, which has leveraged its genome sequencing capabilities to rapid, high-throughput COVID-19 testing. UVMMC is validating a laboratory-developed test using the CDC testing method, which we are preparing for go live on this Thursday this week. We are prioritizing testing by first, the fastest testing we currently have available, and then second, the best interface with Epic and other hospital electronic medical record across the state. In addition, we are monitoring the validation and availability of serologic testing that would not be used for diagnosis, but for knowing who has had COVID, the disease, COVID-19, and may be immune for returning to work or for epidemiologic purpose. All centers in hospitals and sites report to a network coordination center daily call at 4 p.m. where everything relevant is discussed under the leadership of Mr. Al Gobey and Dr. Howard Shapiro. There's also a daily call with state officials and several of our leaders happening in the morning every day. Not surprisingly, area of stress and anxiety revolve around protecting our frontline providers and others with adequate PPE, working in a system across state line with different rules and regulation, and supporting our community partners like nursing homes who are very vulnerable, and ensuring that we are doing everything possible to protect our patients and family. Our faculty providers, community partners have been nothing short of extraordinary. They are deserving of high praise and will continue to need our support throughout this crisis. You can help by respecting social distancing and other public health measures that had been widely publicized, like Dr. Carney said so far, and for following our conservation strategy for PPE and being mindful of the guidelines. As we are preparing for the worst, but hoping for the best, I thank all of you for your engagement. And I believe, and I'm certain that together we will get through this. Back to you, Dean Page.
Thank you very much, Dr. Deschamps. Our next speaker is Gordon Jensen, Senior Associate Dean for Research. Dean Jensen.
Thank you, Dean Page. I'd like to begin by thanking everyone for signing on this evening with this group of medical college leaders. And again, to add my voice to thanking everyone for everything that you're doing. And in particular, with my focus on research, I really do want to reach out to the LCOM research community and thank you for helping us achieve the temporary shutdown of non-essential research laboratory activities over the past week. And your dedication and responsiveness enabled the successful completion of this massive undertaking in a very short time frame. And when we've been back out and toured the buildings, there really are remarkably few people about, which is a good thing. In addition, you're aware that we set up a protocol to designate essential research personnel. And I do want to emphasize that for these folks, it is very important that you continue to follow the isolation procedures that Dr. Carney described when you are on campus. Out of some 500 LCOM research personnel, 129 have now completed the required application review process and have been deemed essential. These are mostly faculty and staff. There are also a number of graduate students and trainees. It is especially notable that 55 of these individuals are directly or indirectly supporting COVID-19 investigations. Now, I'd like to turn next and talk a little bit about the graduate students and postdocs who are such an integral part of our research team here at the College of Medicine. And we appreciate that many of our trainees are understandably concerned about their ability to progress in their studies and research. First, I want you to know that we are committed to supporting you. Second, we will begin to develop reopening plans for our laboratories. And this actually speaks to a number of written questions that we received as well. I actually met with Kirk Dombrowski earlier this morning, the new Vice President for Research, and we are implementing a working group specifically to look at how we would reopen our laboratories in a safe and prudent manner, and likely to be in a staged fashion when the time is appropriate and when we can do it. And of course, we'd be looking to do that at the earliest appropriate, safe, and prudent time. But I do want everyone to know that we are already working on strategic planning about how to reopen our laboratories. As Dean Page highlighted some of the wonderful activities throughout the college, I wanted to highlight some of the stellar COVID-19 research activities that are ongoing. And first, I would mention a lovely team effort by Dr. Jason Botten and his collaborators. And they actually have a preliminary report out already. It's been out a couple of weeks that describe, and it's published in preliminary report form in BioRx. And it's just now being submitted for journal publication. But this actually looked at the approaches to COVID-19 assay, looking at some other reagent kits. And they actually even reported that they were able to completely omit an RNA extraction step. And of course, this was one of the limiting reagent steps that was causing a severe limitation in assay capabilities. So that is one really outstanding example. And the second one I'll share with you is another individual named Jason Bates. And if you watch the CBS News local affiliate dinner time this evening, you will have seen Jason Bates being interviewed on television for a new emergency ventilator that he and his team have designed, that is an airway pressure release ventilator that they are affectionately calling the Vermontilator. Even have a little name on it. Anyway, really exciting development. I think is likely to have tremendous interest, from a marketing perspective, and is a device that should be able to be made quickly and hopefully in substantial amounts. So these are examples of some of the exciting developments in research around COVID-19. Now we have the COVID-19 virus surge. I also would describe the COVID-19 research surge at the College of Medicine, which is really quite remarkable. As of this morning, we had 17 different projects that had been submitted to the IRB for review. Some of them already approved, some of them currently in review. And the dedication and enthusiasm of our investigators to address this pressing public health concern is outstanding. However, one of the challenges that has come with this is that in our surge of research, we have procedures that overlap. We actually are competing for samples, for patients. So earlier today, around lunchtime, we sent out a red cap survey to all the lead investigators on COVID-19 research projects here, asking them to return this to us by 4 p.m. this next Monday. And specifically, this is targeting, our investigators, use of patient specimens that are in LCOM, in the medical center, and in the health network. And what we're really interested in doing here is trying to look at overlap, look at redundancy, look at ways we can align our resources and promote collaboration. So this will give us a real handle on how we might best organize this and support our research efforts. And the exciting follow-up to this will be that we plan an online COVID-19 research forum for all the investigators that are interested in sharing ideas, concerns, and opportunities. So I'll wrap up this evening, one, by just, again, thanking you all for participating this evening. I want to be sure that you know to reach out to me with any research-related concerns whatsoever. Have a good evening, and back to you, Dean Page.
Thank you very much, Dean Jensen. Our next and final speaker is Dr. Christa Zehle. Dr. Zehle is Senior Associate Dean for Medical Education. Welcome, Dean Zehle.
Thank you, Dean Page, and good evening to all of you joining us this evening for this important community conversation during this unique and challenging time. We all can appreciate that the COVID-19 pandemic has impacted everyone. However, as medical educators, we are particularly aware of the impact this has on our students, both personally and for their medical education. The importance of physical distancing has required us to make some difficult decisions. And when doing so, we are seeking guidance from our national colleagues, the Association of American Medical Colleges, the Liaison Committee on Medical Education, our clinical affiliate partners, and our student leaders to ensure that we are making the best decision possible for our students and the public. In addition, the Office of Medical Student Education is closely collaborating with our faculty and staff, as well as technology services, the Office of Diversity and Inclusion, and the library to be able to deliver our curriculum so that our students meet their medical education objectives and requirements, and also receive the support needed personally and academically during this time. And the Wellness Committee is providing resources to support our students' health and well-being. So tonight, I just wanted to provide some updates kind of going by class. Each class, the curriculum for the class has required some unique modifications. So for the class of 2023, the students that joined us last August, their curriculum is being delivered entirely online. And we are particularly grateful for all those involved in pivoting so quickly to ensure that our students had continuous delivery of their medical education. They also are in a course called Doctoring in Vermont, where they spend time in clinical outpatient sites, and we've had to suspend this for now. However, we are exploring options for participation using telemedicine. For the class of 2022, this is the class that just finished their preclinical coursework, and they are eager to get out into the clinical environment. And due to the current situation, for the safety of our students and our faculty and the public, we've had to shift their entry into the clinical curriculum. They were originally supposed to begin on March 16th. And currently it's been shifted. They'll start their clerkship orientation, which will all be done online, hopefully on April 20th, with the goal of having them start in the clinical environment on May 11th. Of course, this could shift because we really need to monitor the clinical environment and ensure that we're making the best decision for everyone involved. And students remain enrolled in their coursework, and they're completing non-clinical experiences to meet their medical education requirements. The class of 2021 is the class that just finished their core clerkships and are preparing for their senior courses in their medical education and preparing to apply to their graduate medical training programs. And their clinical activities have been suspended as well. The current goal is to be able to have them re-enter the clinical environment on May 4th, again, keeping close track of the clinical climate at this time. These students are also enrolled in completing non-clinical experiences to meet their medical education requirements. For students in the class of 2021, often this is a time where they participate in away rotations, and away rotations have really been canceled across the nation, some through May and some even longer through July. The Larner College of Medicine is currently not accepting students from other institutions, at least through the end of May, and this may be delayed even further. And we also anticipate that there will be a uniform national decision about away rotations in the near future. And then we have the class of 2020. These are students who've completed almost all of their medical education requirements. Some have already completed all of their requirements. And this is a time for them to really celebrate with their friends and with their mentors and with all of us who work in medical education on all that they have accomplished over the last 4 years. Match Day is a really big and important day here at the Larner College of Medicine. And there too, we had to make a difficult decision to support physical distancing and provided a virtual experience. We recognize this is not quite the same as an in-person match day, but in a way created a very wonderful, intimate environment with everyone being remote and having remote space stations. It was Space Mission 2020, and I know many people were able to watch that, and I think it was still a wonderful way to recognize the success of our graduating class. For some students, there's still some graduation requirements that have to be met, and these will all be done as non-clinical experiences. And so we're supporting them to ensure that they meet all the requirements that they need to, or modify the requirements given the circumstances. And so many of our faculty are working with students to participate in non-clinical experiences for the remainder of their coursework. So this brings us to graduation. Again, challenging decisions made across the country, and we will not be gathering for an in-person graduation this year. However, we're working closely with the university and with the college and with our students to consider an alternative modified virtual experience for them. And As we also think about graduation, many people have probably been part of some of the conversations in the news about early graduation. And so we certainly are engaging in those conversations with the university as well as with the medical center to determine what options are available for our students. As many of you can imagine, there's been some questions about what about those students who've matched in New York City. And on the national conversations, it's pretty clear that in a surge and a very stressful time, you have to be careful about welcoming new residents to a system that they're not familiar with. So New York City at this time certainly might support early graduates from their own medical schools, but at this time they're not in a position where they can have other graduates from around the country start early. That could change. So right now we're really just having conversations with our own medical center to look at potentially having students who matched here at the UVM Medical Center begin early. Again, this would be if the program is able to and interested in having them start early, and then if the graduate is interested in starting their graduate medical training early. With that in mind, we want to ensure that our students who are now becoming interns receive the appropriate supervision and training that's expected from the ACGME. A couple of national updates just to let you know. So our students also need to meet some national testing requirements with the USMLE Step 1, Step 2 clinical knowledge exams, as well as with the clinical skills exams. Currently, those are, the clinical knowledge ones are delivered by Prometric centers. They are closed until April 16th. Those may be delayed further. They're aware of kind of the national physical distancing that's been extended. And as of on Friday, they hadn't delayed those dates at all, but we anticipate that that may happen. So we're working with our students around that. For the clinical skills exam that was released on Friday, that they have extended the delay further for that type of testing until May 31st. So again, we're watching closely the national scene, working with our colleagues nationally and making decisions to help support our students, but also the public. In support of our students, we are looking at having town halls for each class, with the first one occurring for the class of 2020 this Thursday. And Dean Page and I will be conducting that with the class, just to have an opportunity to connect with them. We really miss our students. They're kind of the pride and joy of why we do what we do. And so it's been really hard not to be around our students. So we hope in a virtual experience, we can at least connect with them and address their concerns and questions. We also have developed a specific website for medical students around the COVID-19 information. And that provides updates that are sent either from Dean Page or myself, as well as frequently asked questions specific to a class here. We also, that's where our LCOM Cares Service Corps Task Force has opportunities listed for individuals to engage in. And I want to make an extra point to echo Dean Page that our students remain enrolled, but it's incredible to see the outpouring of support and the participation in these various activities that are happening in our own community and in support of our medical center, but also in communities all around the country. And we're working closely as well with our clinical affiliates and identifying supports that they may need in the coming weeks. So to touch briefly on the different teams in the Office of Medical Student Education, so just recognizing the admissions office, which is still recruiting students to join the class of 2024 and typically hosts in April a closer look day in person. Today we kicked off their new format, which is a virtual version called L Community. And Dean Page and I participated in that. And it was great to have these prospective students join on virtually and be able to welcome them and recognize their accomplishment in being accepted into medical school and wanting to serve in this profession. So that's exciting. They're going to conduct additional events throughout the month of April. The curriculum team, again, both our preclinical and our clinical curriculum teams who really have pivoted quite quickly to deliver a lot of different online coursework for our students, and then are working every day as the timeline is constantly shifting in terms of re-entry into the clinical environment. So a lot of work being done there. Our simulation lab has had to adjust as well, and they are doing some great exploration of virtual use of standardized patients and working closely with the College of Nursing and Health Sciences as well as our college to continue to identify ways to deliver clinical simulation remotely. The Teaching Academy has been a tremendous support to our faculty and to our staff in terms of identifying resources in medical education when needing to deliver a medical education program virtually. And our affiliate sites, again, as I mentioned, they're all stressed, as all clinical sites are, with responding to the pandemic. So really identifying how we can support them and listening to the clinical environment when we're considering re-entering our students into those environments. And then the medical student services team, which is working behind the scenes to ensure that our students' well-being and their academic success and their personal success are met. So that concludes my remarks on medical education, and I am happy to take any questions that come up during the question and answer portion of the town hall. But for now, I'll turn it back to Dean Page, and thank you again for the opportunity to talk to you this evening.
Thank you very much, Dean Zehle. I liked the comment that you made about almost a paradoxical intimacy of match day. And I've got to say, even though we weren't together, I've never been able to look into the eyes of one of our students right there with their family as they got the news about their residency match. So we do the best we can with the circumstances we have. I will give an update that we've had over 280 individual participants logging in this evening. So even though I can't see you, I wish I could. You get to see us, you can't see each other, but in point of fact, I don't know that there's ever been a town hall that's had this many people sharing an experience like this together. I really appreciate you all joining us this evening. Now, we took questions in advance. I want to mention that we still can take questions on town.hall@med.uvm.edu. Vicki is feeding these into us. It's town.hall@med.uvm.edu. If you have questions, we'll get to what questions we can get to until the hour of 8 o'clock. I'll start with the first one, a question of whether the COVID outbreak will change plans for the new research building. And the answer to that is, I don't know yet. This building project is something that our college needs. At the same time, with finances as they are and the partnership we have with the university to build this building, I don't know whether we can build and break ground as we plan to this spring. I can tell you, in some ways, I would really like to, as a demonstration of optimism in our future. I can tell you also that if we did start building, it would not have a direct effect on anybody's livelihood or our ability to pay the bills and pay the compensation for members of the Larner community. So again, I wish I had the answer to that. These are uncertain times, and we're going to be discussing this with the president of the university, the board, as things go forward, but we've really got to let the dust settle first. The next question I have is maybe a general question, but this was actually asked by someone in a research lab, so I'll pitch this to Dean Jensen. The person comments about the fact that some of this work being done at home has demonstrated that you can get a lot of work done at home. And the question is, after the crisis, are there plans to reevaluate our work from home and to allow employees to do so more openly now that we've proven that this is a real option? Do you want to take a shot at this, Dean Jensen?
Absolutely. Outstanding question. I certainly am intrigued by the abilities of many of our faculty, staff, and trainees to work remotely. And I certainly would be supportive of us exploring further opportunities in that regard going forward. Of course, we do work under the guidance of the main campus in Waterman, and certainly we'd have to have our policies in alignment as they concern our personnel. But I find the idea quite intriguing. Goodness, if we can get past this pandemic and be open to exploring working models, makes perfect sense to me.
Thanks very much. Dr. Deschamps, can you provide other examples, perhaps, how the Larner College of Medicine is supporting UVM Medical Center and the Health Network?
Yes, happy to. First, the Academic Medical Center continues to provide the support and the expertise of a tertiary and a quaternary care medical center with very close communication with the entire network. I was even told today there was an innovation from our emergency department where one of our emergency department physician invented a device to protect providers when they intubate the patients. And this will be distributed across the other emergency medicine departments in the network. Not very recently, we had to send doctors and nurses to a nursing home that is not in our network, but is in our community to provide care for patients with COVID-19 because the local facility was not able to respond to the demand. Our transfer center has partnered with Dartmouth Hitchcock and has presented successfully a plan to the entire state for transfer of patients between medical centers and to respective academic medical centers for those COVID patients that are very sick. And that's one of the examples I can provide tonight.
Great, thank you very much. For Dr. Carney, the question is, how can we be sure that the physical spaces we are returning to eventually, such as labs, hallways, and common areas, are safe? Many are worried about lingering community spread causing another outbreak once restrictions are lifted.
Thank you, Dean Page. I think a couple answers to that. First is we do know the kind of FDA-approved cleaning materials are used to sanitize our environments, and our maintenance staff is well versed in that. The other thing we're doing is making sure that we have reduced the number of people in the workplace to those who are essential, as you've heard mentioned by Dr. Jensen. I think that data from the NIH shows that how long things can live on surfaces and air, it's a very short period of time. And that on the surfaces with the proper cleaning, I think we can feel very comfortable about that. I think the other part of the question is also, how do we know that this won't come back when we all resume our activities? And I will tell you from an international level that people are watching this very, very closely. As an example, in China, as they have passed their peak and their hospitalizations and deaths have gone way down and their illness, and as they resume activities, they will be continuing to track infections, as will other countries and across our United States as well. So people, national experts, Dr. Tony Fauci, that you watch on TV all the time, is well attuned to this and has been giving great advice and ongoing updates. And we are carefully monitoring all those here as well.
Thank you very much. Here's one that just came in for Dean Zehle. The person says, I'm just wondering about the long-term vision for a medical school experience where COVID may recur each year or season and will likely become part of the permanent medical landscape. How do we incorporate this into the ongoing education for students while respecting their safety and minimizing unnecessary PPE use? And possibly for Dean Zehle and possibly Dean Carney, if you want to step in terms of whether you think this could be part of the permanent landscape. But first to you, Dean Zehle.
I think that's an excellent question, and certainly one, that's been a challenge for us during this time. There's certainly so much that can be learned from a pandemic such as this, and our goal is really to have medical students in the clinical environment as soon as possible. So we've been discussing this, and I think one of the ways that we are currently doing this is by offering a COVID-19 public health non-clinical course. And going forward, I think certainly ensuring that students have the knowledge and information they need about viruses, about pandemic responses, about how to protect themselves and ensure their safety with using PPE, about resource limitations. So I think there's a lot here that can be incorporated into medical education. And again, as soon as possible, we'd like to have our students return to the clinical environment.
Great, thank you. And Dean Carney, if you don't mind addressing the second part of that question, and also another question came in on a similar note, and that is anticipation of a second wave a year from now.
That's something that people are watching, as I mentioned, internationally very closely. And that's why the messaging you're hearing about be patient with this social distancing, because people are being very cautious and watching very carefully what happens after the illness appears to have passed and people resume or begin to resume their activities. So we're watching that very carefully. I would also say, make the comments around the safety of people working in our healthcare environment. Hospitals and health systems are used to working with patients who are seriously ill with a range of infections. And that's why they pay such careful attention to the environmental sanitation and the protection of the entire workforce. And this is no different. The last perspective I would give you is that one of the big picture messages around social distancing is the idea of flattening the curve. If we're all able to do this, and you slow things down and you reduce the burden of illness in the community, protect yourself, your families, protect healthcare workers, it flattens the curve and buys us time to develop treatments and even potentially vaccines. And those are things that you hear about at the national level that are going on very, very as quickly as humanly possible. Thank you, Dean Page.
Thank you, Dean Carney. And I should mention how fortunate we are to have Dean Carney as part of the team. Many of you may not be aware, she was Commissioner of Health for the state back at a time where I believe it was a little bit less hectic to be Commissioner of Health for the state of Vermont, but likewise, your background is tremendously valuable. Dean Deschamps, here's a question, and I'm not sure whether this applies to you, but I'll send it your way. What is the policy on PPDs? Back in March, someone, I'm not sure if this is a student or otherwise, was told they needed to obtain them themselves. This is a PPD, not PPE. And, but the problem is that most outpatient clinics are closed except for emergencies. And are individuals allowed to break self-isolation to go to student health? So I guess this is a student to get a PPD placed and then read. Dr. Deschamps, what do you think about that?
Thank you for this question. If there was an urgent need, I think we could accommodate having a PPD done and then read from a distance by using telemedicine. So there are probably rare situations, and maybe Dean Carney can bail me out on this one, but there are rare situations where an urgent PPD is indicated, and the person would have to call our clinic, our employee health, or one of our internal medicine clinic, and we could arrange a PPD and then read it from a distance. But the indications are probably rare.
So you might be willing to forego that expectation of employment for a short term during this situation?
Yes.
Dean Carney, do you have anything else to add to that?
Oh, that was perfect. Thank you, Dr. Deschamps.
Thank you. Dean Jensen, there's a question that makes note of the question is, what is the college or university doing to support the technicians and research associates whose days are normally filled with bench science? There's just so much work that can be done remotely. And what happens when, through no fault of their own, their medical and vacation leave has been exhausted? Is there a mechanism in place for salary support for these employees?
Well, thank you for that important question. And I can assure you that has been on Dean Page's and my minds for the last few weeks. And I would start by saying, one, it is most definitely our desire to keep positions whole and intact, if at all possible. And as you might imagine, there's a couple of variables here. One is we do not yet have enough information. We don't know yet for sure when the surge is peaking. We don't yet know when we're going to be in a position to reopen our laboratories. Obviously, in the interim, I very much favor everyone doing whatever they can to contribute remotely. The other variable here, of course, as I alluded to earlier this evening, is we do have to align our approaches with overall UVM policies and guidance. And of course, we'll be waiting for that around these particular positions. And lastly, I would think it's fair to say that we will most definitely seek to reopen the labs as soon as we possibly can when it is safe and appropriate. So we have more information to garner, but we really do want to do all that we can to support everyone. Thank you.
Thank you very much. We've got time for just two quick questions. I'm going to take one and then pass it on to Dean Zehle. The question is providing an update on the LCME self-study and the impending visit. Impending visit, I hate to use that term. I think this is an opportunity for us to become better and learn, but we do have an upcoming visit scheduled in April 2021. I'll always tell you the truth. I'll always tell you what I know and what I don't know. And at this point, I don't know exactly what's going to happen with the timing of that visit. Just today, we received word that perhaps our self-study process was going to be less onerous than typically is, but we're still processing that. So at this point, we ought to continue to do our work preparing for LCME, as we already were, within the confines of competing pressures. And then as soon as we learn more, we will pass that along to the team as to what different might be expected, or even if there might be a delay. The last question, Dean Zehle, is an interesting one. I'm curious to know if there's been discussions about possibly implementing shifts in AIs or acting internships, which will accommodate more students in required AIs during the fourth year. For example, day-night shift for emergency medicine, surgery, and medical specialties. Almost all services are active 24 hours a day. Why not use this to our advantage during these times? A creative question and potential solution. Do you have any response to that, Dean Zehle?
Yeah, absolutely. And just before finishing today, I do want to remind all students that Dean Page and I are planning on doing town halls per class, with the first one this week for the class of 2020. So any additional questions or questions we maybe didn't get to, we're happy to address them during those times. So with this particular question, yes, we have looked at a lot of creative educational options and splitting day and night shifts, not only in the advanced integration level, but possibly in the clerkship level, is being considered, just to allow students to have more opportunities to be in the clinical environment. There are some differences in day and night shifts, and so we're taking that into account and how that would impact that particular experience. But yes, the educators have certainly considered that and are working to potentially implement those changes.
Great, perfect. And thanks for clarifying that AI is not artificial intelligence. It's not acting internship, but advanced integration. Thank you. And I really want to thank the four panelists. It's such an honor to work with them every day. as we get through this. The hour is nigh. I can actually see a full moon out the window. And if you have a chance, go look outside. Stay 6 feet apart, please. In closing, this is not what any of us imagined the spring of 2020 would be like. This is a difficult situation. I can't minimize that. This is as difficult as anything we've gone through in generations, and it's not over yet. But things will not be this way always. Our community is hardy and resilient, as is our state and our country. Humanity has faced challenges since the beginning of time. We've always prevailed, and we will do so again. So I ask all of you to take heart, and we will get past this. We will meet together in person again, and I look forward to that day. But in the meantime, please take care of yourself and take care of those you love, either in person or at a distance. Look out for ways to help those in even greater need, but don't hesitate to reach out to others for support. And please practice social distancing, make that physical distancing, hand hygiene, and wearing a mask while outside. We can get through this together, even as we are apart. So please stay well, and thank you for joining us this evening. Until we meet again, good night.